I think to save some time, encompass all of the discussion that we've had so far on the skill sets that you bring to the table. There are organizations that feel that they have to hire someone with the certification, and they won't even look at you if you don't have that certification. And that part of that's the vendor influence that's, kind of locking down, let's say, the hospitals, for example. And then there's other organizations that want to look at your skill set holistically, and if you can help them with or without a certification, they'll find a way to get you a certification. Beyond that, yeah, hospitals have entry-level positions that we've talked about, training, documentation, technology, whatever that is. They'll hire you, and then they'll get you certified, on let's say Epic, for example, in a specific area that you may have interest in. They'll also probably have you sign a non-compete saying, if we're going to train you, you're going to stick with us for 18 months or 2 years or however long, because we don't want you to get that training and then all of a sudden, 100 recruiters are calling you and they're offering you $150 an hour and you're going to fold. So, there are opportunities, and I think, a lot of it, the build up to that question and what we talked about, can get you there and get you the opportunity to get certified. I'll leave it at that.
I think I'd respond to that by saying that's a trick question. The reason it's a trick question is because it's very appropriate today. It's going to be much less important in 2 or 3 years. It wasn't all that important 3 to 5 years ago. We're in a crunch right now where everyone's rushing to get in systems. There's only a couple vendors that are selling a lot. Those people are at a premium. If you want to be an implementer, either for a vendor or for a provider, yes, you need that certification. There's a lot more things going on in healthcare informatics and implementing. And we've talked about a lot of those already. The operations, the security, if you want to just be on the IT track, the CIO, if you want to manage revenue cycle applications, if you want to manage other administrative applications, that's a good 60 to 70% of the rest of the market. It's just where all the activity, all the buzz talk is today. So,
no, it's a great point. I mean, we tend to focus on what's getting the most press, and you automatically go to Epic, but you have a great point, Mike, and I would add to that, we do a lot of work in the federal government for healthcare. In the VA and the military health system, we're doing very progressive work in all of the things that you do, and I would encourage you to look to those organizations as well. I mean, the VA is not just central to, Washington, D.C. They've got hospitals, 158 hospitals across the U.S. So, don't discount the things that Mike said, that there's a lot of opportunity without having to get a certification with a specific vendor.
Yeah, let me just ask about a show of hands. How many of you want to be an implementer? Implementing is really hard work. And I only saw like 3 or 4 hands go up. Okay. Talk to some of these people who are implementers and make sure you know what you're in for. It's very rewarding work, but boy, talk about taking over your life. It's you'll learn every nickel of it if you're getting $150 an hour.
Dave?
I would add, and I would agree with everything that was said, and what I would add on to that is that as an implementer, they look for certifications, specifically to my knowledge, from what I know, in the Epic market, even though we don't work in the Epic space in our firm. The other vendor applications are not as certification specific, they're not as formal. They're looking for experience. And what I would say specifically in today's market is that ideally people want experience, but as these organizations are not able to find enough people with the experience, then the requirements begin to lower. It may not be implementations, but it might be having supported the product or something like that. Supported a bit of a very strong end user. So I think what a lot of people do is they look for the ideal job, and they don't quite have the qualifications for the ideal job. What they might do is think of the job you could step into but after a little while, you now have some of that experience to be more competitive in the job you want. So unfortunately, it's more of a two-step process. But if you think 6 months or a year from now, you're better off doing that as opposed to being in the same place 6 months later.
Bonnie?
I don't look for certification. I look at someone's resume, and that's your marketing document. And as healthcare IT people, I look for specific vendors and products, and I look for keywords and that type of thing. What you don't want to do is have your resume look like somebody who's applying to Sears. You want to get your specifics out there. So to succeed in the marketplace, I see consultants that move from place to place and help implement or help lead projects in different organizations, different vendor products. They're not certified, but they have a tremendous amount of experience. And so a lot of candidates I like to look at and talk to have maybe vendor experience, maybe consulting experience, maybe some hospital experience. But those three together that's going to be successful because you have a wider vision of the world. If you've only worked at one place for 5 or 6 years, you're not going to have as much. So I would recommend definitely looking at diversifying your career, getting those specifics into your resume. And we're different. We have different things going on in healthcare than other industries.
I'd add one more thing. You don't need a certification to get a job at the vendor. And I can tell there's at least 2 big EMR vendors on the physician side who are dying for implementation people, and those are Allscripts and NextGen, and there's going to be a lot more. And the HIMSS national program is the world's biggest job fair. Hopefully you all brought with a stack of resumes and feel comfortable walking up to people in the booths.
Rachel, do you have anything to add?
Not too much different than what the group said. I would agree that the vendor space was a good place for me to start and a good place for me to build exposure up. And I do also agree that the market is changing and some customers insist on certain words being on a resume, and I hate to see that because there are a lot of candidates that may be better that don't necessarily have that word on their resume. So I am seeing more of our clients open up to different types of experience and similar roles that are comparable and translatable to the industry, so I hope that continues.